Okay, we're going to get started. Good evening, everybody. Welcome, and thank you for joining us for Disability Access and Advocacy, the first event in our new Democratic Spaces series. I'm Stephen Bruckman. I use he, him pronouns, and I'm a white man sitting against a dark green virtual background. I serve as Deputy Director of the SNF Agora Institute, an academic center and public forum at Johns Hopkins that is dedicated to improving and expanding civic engagement and informed, inclusive dialogue as the cornerstone of global democracy. I want to thank Dr. Bonnielin Swenor and the Johns Hopkins Disability Health Research Center for partnering with us on this event. And thank you to the wonderful co-founders of Crypt the Vote for taking their time to participate in this important conversation. Democratic Spaces is a series of discussions about how we can cultivate spaces, real and virtual, that enable robust participation in democracy. A healthy democracy requires that all of us, no matter our identities, affiliations, beliefs, or creeds, play a role as members in civil society. Once a month this spring, we'll be hosting a conversation in which we'll explore how we can build the spaces that invite all voices, especially the voices of those who currently face barriers, into those conversations. Today, we'll be talking about how we can ensure that people with disabilities have full access to participate in our democratic institutions as voters, organizers, and policymakers. Just a little bit of housekeeping before I introduce our guests. Just in case you don't know, this is a panel discussion. The panel portion will last for about 40 minutes, and then we'll be taking questions from the audience, but you can feel free to submit your questions at any time using the Q&A function, and the moderator will be choosing questions throughout the evening to pose live to the panelists. Also, just note that the chat function has been turned off for comments so that we can use it to share relevant information among the panelists. So now I'm excited to introduce today's guests, and I'll ask them to turn on their cameras at this time. I'll be introducing our moderator, and then she'll introduce our guests from Crypt the Vote. Dr. Bonnielin Swenor is Director of the Johns Hopkins Disability Health Research Center and Associate Professor at the Wilmer Eye Institute, where she focuses on identifying and addressing inequities for people with disabilities. Welcome, Bonnie, and it's over to you.
Thank you so much. I'm really grateful for this opportunity to partner with the Agora Institute and for this session today. So I am Bonnielin Swenor. I use she, her pronouns. I am a white woman with blonde hair, and I'm sitting in my office tonight in front of yellow walls and a white painting behind me. So for those of us joining who are new to disability inclusive spaces, we are describing ourselves on this virtual call so that individuals with vision impairment or who are blind can also understand who is speaking. I would like to warmly welcome our guests, the co-founders and the co-organizers of #CryptTheVote. Alice Wong is a disabled activist, media maker, and consultant. She is the founder and director of the Disability Visibility Project, an online community dedicated to creating, sharing, and amplifying disability media and culture. And she's the editor of Disability Visibility, which is first-person stories from the 21st century, an anthology of essays by disabled people. And welcome Andrew Pulrang, a disability activist and former director of a Center for Independent Living. Andrew is also a disability-focused freelance writer and a regular contributor to Forbes. And Gregg Beratan, who's the Director for Advocacy at the Center for Disability Rights and has more than 2 decades of advocacy and community engagement experience in the disability community. Thank you all so much for being here with us this evening. So I'm going to just dive right into it and ask the 3 of you a question that I'm guessing you've been asked a number of times over the past few years. Can you start by telling us, the audience, a little bit about what #CryptTheVote is and how it originated?
This usually falls to me, I guess. I'm Gregg Beratan. I'm sitting behind a black background or in front of a black background with the Crypt the Vote logo to my, I guess, left or right. I'm not sure. It's a ballot box with different accessibility symbols and Crypt the Vote below it in rainbow colors. where to start. I guess I'll start with where we started, and then I'll let Alice and Andrew talk about a bit more about what the hashtag and the campaign is. But we were all, we knew each other through Twitter in 2015, 2016. And we, like everyone else, were watching as they had, I'm guessing, about 25 different primary debates. And by about the 12th, it started to become evident to those of us in the disability community that there was just no sense that any of these people even recognized that our community existed. And we all sort of tweeted about the same thing at the same time. And I reached out to both Andrew and Alice, say, can we start a campaign to sort of bring disability into the mainstream? Because without our community, this isn't going to happen. And Alice came up with a hashtag, which is, I think, probably about 90% of our success, or I mean, it's 60. I'll give the other 40 credit to the disability community. But and we thought we'd maybe live tweet the debates, have a few discussions, and see what happened. And within days of even announcing the hashtag and what we were planning on doing, the community just took it over and was tweeting on it 24/7. They were tweeting at candidates. They were having discussions about issues. They were asking questions of people, you know, who were running for office, talking about policy, sharing news stories, and it just sort of took off to the point where in the past election, we organized 2 chats with presidential candidates who actively engaged with our community, and we saw, I mean, I don't know that this is all us, because there were lots of people engaging with candidates, but we saw much more engagement in this past election with the community from people running for office at all levels. And I guess I'll leave the rest to Alice and Andrew.
Andrew, do you want to do this?
Sure. That's the way it all happened. And you know, I would just emphasize the 2 things. One is that for me, the most gratifying thing has been the everyday conversations that just took off and have never stopped. I mean, I check it every day. I try to contribute something every day. And there's never been a day when there wasn't something happening, when people weren't talking about the issues. And for those who may not be 100% sure how this actually works, you know, in Twitter, when you use a hashtag, the way it works is it ties the conversation together. At least that's how we use it. There's many uses for a hashtag. In one sense, it's a slogan to say something, and it works that way too. You know, Crip the vote. Crip is kind of an inside reclaimed slur against disabled people that's been kind of repurposed for some as a point of pride, a little irony, a little fun. And as Greg alluded, I think that had a lot to do with the initial interest, because people saw it and were like, what is that? It sounds like it might be interesting, and then looked into it. But anything that you say and you add the hashtag thing to it means that anybody can look up that hashtag and see everything that everybody said about it. So one of the big things this campaign does is tie conversations together. So anytime anyone wants to say anything about disability issues or politics, and they want to add it to that conversation, they just add Crip the vote to the thing that they're saying. So the everyday conversations were amazing. And then the other thing is we started doing scheduled chats not connected with debates or particular candidates, but topics. We started doing them. I don't remember exactly when, but it was within a few months of starting the whole campaign. And that has been a core activity too. And maybe Alice could talk a little bit about some of the topics that we did and how that's worked out.
Yeah, hey everyone. Just to describe myself, I'm an Asian American woman. And I have a mask over my nose attached to a ventilator that I'm wearing a fluffy gray fleece jacket. And my background is completely dark because I'm basically a nocturnal creature. I'm delighted to be with you all today. And I just want to emphasize, let people know that, we're just 3 individuals. This is not our full-time job. We are not digital organizers. This is not kind of something we were trained to do or, professional careers in. But I think that's what's kind of exciting too, is that we're just 3 people pretty passionate about politics, pretty passionate about disability issues, and wanting to create something that we haven't seen yet, that we feel like is needed. And I think one of the reasons why crypto vote kind of took off is that there has been a void. There has been this overall kind of neglect and exclusion, let's just be honest, of disabled people. Even though I think for decades, right, they've always been advocates working and, doing a lot of the grassroots work and just, paving the way. I think we just happen to use this digital space. And, even though Twitter can't be trash, this is a tool that we have. This is a tool that we have as individuals who can mobilize together. And that to me, because we don't need to build any other infrastructure around this, it's been pretty remarkable that we could do this as a community. So I think that's kind of the only thing I want to preface in terms of, I think some people kind of had this idea that we're just, this is our career or life's work, but we do this on our own time, and we do this out of love and out of a real kind of, I guess, commitment to kind of what we believe is possible. And I think that's the overall thing that I just want to share about this this collaboration. And it's really been a collaboration, and we don't have any sort of grand plan or some sort of timeline. We've always been kind of responsive to what's happening, the things that we see that are emerging, and the way we schedule our activities, such as, for example, live tweets of conventions or debates, or our scheduled Twitter chats. We've always kind of just done it at our own pace. We've kind of checked in with each other all the time. How do we feel about this? Should we invite this co-host for our Twitter chat? We just really try to not feel too kind of burdened in terms of expectations, but always doing it, in collaboration, in partnership with each other as 3 people, but also with the broader community. And I'm just gonna drop a link right now to a book about hashtag activism, in case anybody would like to learn more, because I do think hashtag activism is a real thing, and that it is something that has so much potential and power, especially for marginalized communities. And I think this is where people poo-poo sometimes still online activism, but it's definitely real. And I think this is one of many examples.
Yeah, thank you. So I'm just going to say to the three of you, we had some planned questions. I'm going to go a little bit off script based on your responses. And, it's so interesting. I've heard you all talk about this before of, the idea that online activism isn't sort of perceived as real or having an impact. And, as a member of the disability community, what you all are doing and have done absolutely has had an impact. And so, maybe you could talk a little bit about, from your perspective, what that impact has had, first of all, or what barriers in having an impact that this opportunity for online activism removes or addresses for the disability community, or even other communities, if you're willing to respond to that, I think.
Yeah, if I could start, I apologize. I should have described myself the first time. I'm a white man with glasses, and I've got a blue shirt and a ordinary my apartment background. So yeah, I think one of the characteristics, one of the things that I think has made us successful or has made this fun and workable is that I think we've had limited goals. And I don't mean limited in a bad way. I mean, we never have had like grand ideas about that we're going to change the disability community or change politics. And we have never had statistical goals or like we have to accomplish A, B, and C. And partly, again, that's because it's just 3 people. We don't have a board of directors that's telling us that we have to do stuff. We don't have funders who are breathing down our neck saying we have to accomplish our objectives and all that kind of stuff. So that's allowed us to be flexible, to again, have limited goals, pursue, I guess the only goal that we've always had is to have a discussion and to keep it available for people, keep it relevant, keep it provocative when necessary. And all of those are things that 3 people are able to do using Twitter and a little bit of Facebook and a blog. You don't have to have a lot of in-person activity to do that. So our goals, one of the answers to your question kind of is that what we set out to do is shaped by the medium that we're using, right? So we didn't say, well, we want to do this to the disability community. What shall we use? We actually started out with the medium and said, well, we use Twitter. We're talking on Twitter right now. What can we do with Twitter to make a difference? So I think that's part of it.
And I think it's interesting now, particularly that this particular moment, you're seeing all of these mainstream organizations that have usually relied on the in-person visit, legislative visits, etc., who are adapting and adopting the techniques the disability community has been using for years and trying to learn from what we've been doing, what other people in our community have been doing to get at politicians. So calling into legislative meetings is nothing new to disabled people. The past year, every other organization in the country has had to learn how to do that. It's helped people come along and see the value of this type of activism and what it can actually do.
Yeah, and I think this is hopefully, it's also helped people feel like they're not alone. We're still, here we are in the 21st century, and there's still a lot of disabled people who just feel like, they're not connected with their local community for lots of different reasons, many structural and social. And they feel like, oh my gosh, am I the only one who cares about this or thinks about this? And this is a way for people to realize, like, oh my gosh, there's people all over the country and really internationally too, that our struggles are similar or our struggles. I'm learning new things from people all the time. And I think that's the really exciting thing too, that there's so much out there. And I think the tag is one way to kind of explore that. And of course, there are lots of other hashtags out there too. So this is not like a singular thing, but it could be a gateway, right? This is a really exciting thing that it's very porous. And I think that's what's nice about social media is the fact that you can grow and learn and follow new people that you would probably never encounter in their real everyday kind of interactions. And that to me is really exciting. You know, I use the tag a lot for lots of things that are happening abroad, you know, outside of the United States, and they're not just about voting, right? It's just, I think we've got to definitely, people know that even though the tag says vote, it's much more about political participation. And I think that's really exciting too, that people feel like they also are wanted and needed in terms of getting involved, and that people can get involved in lots of different ways, right? This is like some of the most basic ways of being kind of politicized and being activist is just sharing information, telling your story. That's really effective advocacy, even if we don't label it that way. I think that to me is hopefully something that people take away from that. Oh, you don't have to be, you know, organizing a rally. You don't have to be doing all kinds of things. And I think especially with this last election, but before that too, there have been disabled people organizing, you know, just either, you know, just doing the door-to-door stuff, but also digital organizing. That's been really awesome to see that, you know, especially with this pandemic and technology, that there are more opportunities now. And we've seen campaigns also, presidential campaigns also hire disabled folks. And these disabled folks are using all kinds of tools, such as Twitter, to really, you know, communicate and do outreach to the disability community in very explicit and visible ways. And that to me is really, really heartening.
Yeah,
You
no,
know, what,
go ahead.
sorry. Well, I was going to say, I think another thing that addresses this question of how useful online advocacy or social media advocacy is that we made it pretty clear from the start, for instance, that more traditional disability organizations and those that do more traditional activism and policy development were welcome to use the hashtag to get messages that they had and news out to the community. Because actually one of the you know gaps that we've always perceived is there's actually a lot of really high level sophisticated activism going on, but so many actual disabled people don't know about it because the networks really aren't there. Now they are forming much more quickly, partly because of social media. So, you know, everything from ADAPT to policy development shops, you know, campaign organizers, candidates running for state legislatures or town councils can all use the hashtag to say, hey, here's what's going on, and kind of give out action alerts at times. You know, when something important is happening, people have used the hashtag to say, get on this now. This is super important. You need to know. And with it being a live medium, you know, we know about it right away. And so I think there's value in that too. And as Alice alluded to, it's not just our hashtag. We overlap a lot with some others whenever it makes sense. So a lot of times we'll put other ones on too. You know, the pandemic has produced, you know, high risk COVID as a hashtag, and variations on that. No body is disposable as a hashtag, you know, and again, variations on that, a lot of overlap there. So it all works in a kind of an amazing way. And, you know, part of the remarkableness to me is watching it happen. From my perspective, I'm just trying to keep up. It's like, I'm not even doing, you know, I'm doing it, but I didn't come up with the idea. It's like, okay, this is the way things are happening. Let's use that. Let's see how it goes. So part of my motivation is almost curiosity. Like, what's going to happen next? How is it going to morph into something else? That's been really, really fun.
Yeah, thank you. You know, it is so interesting. I agree. And seeing how, you know, as this series is called Democratic Spaces, how this virtual democratic space with Crypt the Vote has really, as you all described, evolved beyond voting, right? And the hashtag Crypt the Vote is used in so many ways and has, you know, a meaning now that's bigger than that. And it does feel like in this moment there is a lot of traction to use these virtual spaces to importantly advocate for the disability community. And so, you know, COVID-19 has been an interesting layer on top of that, right? And so I'm curious, you know, with this past voting season, which was a really interesting one because of the pandemic, you know, what your perspective was in if this virtual democratic space or the shift in the connection between the disability community, how that all impacted the opportunity to vote or access to voting during this time of COVID. And if we see some traction or change moving forward, and I know that's a big question, but I guess I'm just really interested to know, you know, if this was, how this impacted at this exact moment in time in COVID, if that makes sense.
I guess I'll just jump in real quick to say, you know, while things have definitely improved in terms of accessibility and disability rights, but here we are over 30 years after the ADA, and there's still really very significant barriers to voting. It is still kind of so bananas that across various states, like disability rights organizations still have to like sue and say like file lawsuits to say, hey, you know, your buildings and your polling places are inaccessible, your website about elections are still inaccessible, or that, you know, you're still not offering accessible absentee ballots. I mean, this is just so kind of depressing, but also, you know, it just shows how much work there remains. And I think this pandemic has showed that, you know, access is different for everyone. And we still have to absolutely, you know, demand and expect that every person, regardless of their disability, can vote independently and privately. And I think this past election, I just read a blog post by Eve Hill for the Harvard Law Review that said like there were 10 lawsuits across different states that had been filed because with this pandemic and usage of absentee voting, there was a lot of access issues, and that had to take lawsuits for people that try to do the right thing. And many of these lawsuits were done at a time where it was too late by the time it was November. So there's such a long way to go, in my opinion, which is, you know, just my random thought.
Yeah, I mean, I think it's nice to say that things have improved, and I'm sure there is evidence that some things have improved, but there's still so much further to go, and we still see so much resistance from places using disability access to suppress votes of Black and brown voters to, I mean, just recently the what's it called? The Election Assistance Commission issued their voluntary voting system guidelines, and they ignored all the recommendations of the disability community. So they didn't ensure accessible remote voting. They didn't prohibit segregated in-person voting, and they didn't set any schedule for people to states to update their voting equipment. So if an organization that's supposed to be focused on making elections accessible is ignoring the disability community, there's still a lot of work to do.
My concern.
Oh, go ahead, Andrew.
Well, along these lines, I mean, one of the things I'm worried about is, looking at the mess that we had right after Election Day. My sense is that some of what motivated that or provided frameworks for that was some people's discomfort with a lot of new systems being added kind of on an ad hoc basis because of the pandemic, which was tremendous for the disability community and was tremendous probably for overall voter participation. And it happened kind of quickly because of the pandemic. I mean, compared to the slow pace of any change in electoral processes in any other time, it was kind of remarkable. And I see that as a positive. Flaws and all, in general, it was kind of amazing. But I fear a backlash. And we already I've started to see that with states kind of saying, okay, we did that. Now let's take a breath and go back and be restrictive again. And I think that's something that we're probably going to have to deal with over the next several months, maybe the next several years, is a step back. And then, I'm hopeful, but I'm worried that that progress, might not last if we don't stay on it.
Yeah, and I'll just to add to what Andrew was saying, I think there was, depending on the state you're in, there was just a lot of kind of mixed messages where certain states required people to vote in person, which put a lot of high-risk people, having to make this decision of, oh, do I exercise my right to vote and put myself at risk by waiting in line? Or, other states where it's like all absentee ballots. And that also is really a lot of disabled people who just need a way that's accessible, that's also absentee. So there's a lot of kind of like either ors, which is just really unfortunate. And again, this last year was a hot mess in terms of just how states were able to adapt and just adjust to this pandemic. And hopefully the lessons they learned will be carried forward, because I don't want to go back. I don't think just even if it's like this, where I think pre-pandemic, sometimes getting organizations or conferences willing to do online events was sometimes a big ask. And sometimes, for somebody like me, I don't travel. So, I don't go to a lot of things. And I, sometimes I would make requests to say like, hey, can we do an online panel instead? And they're like, well, we feel like it's much more, engaging when people are in the same space. And I get that too, right? Like that's, but hopefully people would realize like we can have hybrid kind of approaches, and that we want to bring everybody in as many creative ways as possible.
So building off of exactly what you were just saying, Alice, what do you all hope and are looking for in the future, I guess, is trying to formulate this thought as I'm listening to you all talk. I guess, what is the pressing issue right now that crypto vote is being attached to? And, what is your hope that it will be used in continuation for? Do you hope it will expand, or how do you see it being used moving forward?
I mean, I can't speak for, oh, sorry.
Go ahead, Greg.
I can't speak for all of us. One thing that has consistently emerged from the discussions on the hashtag that I hope more and more people realize, and this is something we were really heartened to see come out of some of the mouths of the politicians this past election cycle, is that all issues are disability issues. And I mean, I'd love to see that understanding spread. I don't think we have any ambitions for the hashtag beyond continuing to support and work with the disability community that means so much to each of us. But I mean, I think that's certainly something that we'd all agree on and like to see continue. I'm sure there are other things that, however, though.
Yeah, I agree with Greg. I would say the more immediate, probably the most immediate issue right now is vaccination, access to vaccines for COVID. That's, probably going to be the short-term most active issue. When that sort of is passed, however that ends up, at some point relatively soon, it probably will be kind of over-ish. Yeah, beyond that, I'm not sure, but I would agree with Greg. I think the whole point, our point is to just, as long as people want to keep using the hashtag to communicate on these issues, we'll just try to do our best to keep it open, keep it going. I think probably we want to get back to some periodic, monthly or so topical chats where we actually set up a specific topic. We tell people in advance the questions we're going to ask. We get, a guest host to come on with us who's an expert in that subject and have a scheduled chat on something, on actual issues. We haven't really done that in a while because of the election, and before that even because of COVID and how that took over everybody's time and imagination. Yeah, and finally, I would say, for the long term, before the pandemic, the way things were shaping up was that 2020 was the most exciting year yet for disability policy, because tons of candidates put out really sophisticated disability policies, not just like 5 issues mentioned, but like 10 issues really fleshed out. And then the pandemic hit and sort of everybody kind of forgot about that, sort of, or it became less of an exciting thing because we had other stuff to worry about. And I hope that going forward, that future candidates will remember to do that, and that will become the normal thing to do, that candidates feel that they have to do, that they have to have a well-researched crowd, with more than one person having input, slate of a full range of disability issues, because that gives disabled people something to vote for, which frankly they often feel they don't have, and that's a big barrier too.
Yeah, and I guess my final comment is that, I think that the tag that just people who are engaged or connected, part of it is to mobilize, but I think also holding people accountable, holding institutions accountable is, for me, one of the purposes of, I think, being, politicized and being involved. And, this past week, the whole blackout in Texas and various states, again, this is a major disability issue where we see policymakers, leaders completely fail their people, and who are often the ones who are most impacted, the ones who die and are harmed, marginalized, vulnerable people, and disabled people are part of that. And I think, again, this just reminds us of our relationship with the state and how we gotta use as whatever we have in front of us to really push back and to demand accountability, to demand transparency, and to demand action. So I think that's always kind of my personal delights of this hashtag.
Thank you. I'm really grateful for that perspective and to understand how you view this and the work and the amazing accomplishments, I think, of the hashtag. It lives on. And so now I'm going to turn to some questions from the audience, which I'll read to you. We have about 15 minutes left for that portion. So the first question from an audience member is, do you all think that disability advocacy and virtual community building will get harder after the pandemic recedes, when the country returns to a less online embracing style of politics?
I'm going to make a wild guess and say, I don't think it will get too much harder. I actually am optimistic that people will have learned at least a few advantages of doing things online more than they used to. I'm not optimistic that it will become viewed as a fundamental accessibility issue, issue of fundamental rights and access. That would be too much to ask. I hope that they would, but I'm not optimistic that it'll be embraced in that way. But I think that people will at least begin to think, why spend millions of dollars or thousands of dollars a person to have a conference in a location when we could all just hop online and have a conference like tomorrow? I mean, if people don't embrace that to some extent, it'll be amazing to me. That's what I think. Anyway.
Just to jump in, I think to me, when I saw the Democratic National Convention all online, I actually thought it was like, that's so much well put together than any sort of like multi-million-dollar like thing. And the way it was so much more tighter and focused and well produced and well organized, I would love to see that happen again the next 4 years. So who knows?
Yeah, I mean, I in terms of organizing, I don't think it'll have any impact. I think our community's been organizing this way for eons, and we're very good at it. And we in the disability community, you see some of the most sophisticated organizing techniques I've seen in any political movement. So that will continue. Now, will some of the access that we've seen over the past year retract as people feel more entitled to demand in person, or possibly? And that would be a shame, as Andrew said. But I think our community is less likely to accept that for the simple reason that we've now seen them accommodate us. And it's hard to withdraw rights once they've been given. So hopefully people will push back if that retraction does start to take place.
Thank you. So there's a question here on a topic that I think we had discussed before this session, but never made it to our discussion. And the question is, can you talk about the importance of representation and having members of the disabled community as legislators?
Well, the one thing that I always bring up is that one of the things we've done with CryptoVote is periodically do an online survey of like what people care about, because we want to get a sense of which issues are more important to our participants and what they'd like us to do, what their priorities are, that sort of thing. We've done, I think, 3 of them, and in all of them, we would always list a bunch of pretty specific goals, like more employment or better home care, that type of thing. And we always put in as a goal to choose from having more people with disabilities run for office, get elected, and get appointed to like political positions. And that always comes out on top as the top priority. So for whatever that's worth, it's the people that participate that are voting. It's not a scientific survey, but it's interesting that always comes out as the top priority. I think people with disabilities who are involved in politics kind of instinctively feel that is super important alongside the more substantive like policy issues. And that's about representation. So for whatever reason, I think they feel it's important. On the other hand, sometimes people with disabilities get elected to things and are super disappointing. I won't go any further with that, but when you open the door, I mean, and it's totally fair. I mean, you open the door to politics, you open the door to politics, and everybody's going to come through. Everybody finds this out. Every liberation movement discovers this. It's probably long-term a healthy sign. Doesn't make it any easier to deal with, but it's also a reminder that simple representation is not everything. Just being disabled does not make you like the best choice. But for the community, it's good to see that it's possible.
Yeah, and I was just saying that I think it's been much more of over the last few years, if not the last decade, we've seen more candidates be very open about their identity and all of the different identities that they hold. And that to me has been really just wonderful, because it's no longer something that they have to hide or just kind of skip over. So, there's a lot of politicians who are constantly talking about disability issues, disability rights. There's one person who's a member of the New York State Assembly, Yulia Liu. She's a really example of somebody who's so engaged on Twitter as a representative of her districts, who's constantly, organizing and really talking with the public and engaging with the public through Twitter. And she's very open about, she's proud to be Asian American. She's proud to be autistic. This is just, she's proud to be a woman. And I think this is what hopefully the future, this is going to be the future of what we want and what we deserve.
Yeah, I was gonna say the same thing, and I'm really glad Alice shared Newlin's links, because she's fantastic, having done some work with her office. There's some great people out there. We're starting to see, I mean, yes, there are the few people our community would like to disown, but we've also seen other politicians in Pennsylvania and California it's been wonderful to see people start to run and be out and proud and own their disabled identity, because that can only help our community.
If I might, I think it's good to kind of shout out an effort from the National Council on Independent Living, spearheaded by Sarah Blahovic, who has been running a training program called Elevate for people with disabilities interested in running for office or learning about how they might do that, which I hope will continue and expand, because that's an important part of representation, is not just taking it by chance and hoping that disabled people run for office, but kind of giving them tools and more than what just a generic like how to can do for disabled people who want to run for office. So that's a really important thing too.
Yeah, and I dropped the link into the chat box to the Elevate program, and I think this also speaks to part of the infrastructure and systemic barriers. I mean, clearly, campaign financing, money, and a lot of things prevent people from running for office, and frankly, it turns people off, right? It's a very, I think, probably realistically, a grubby, very difficult process to like raise the money, just get the staffing and everything you need. And, what if a person with a disability who's, on SSI, what if they are a brilliant candidate and wants to run for office? Like, what are the ways that not only the community, but also what are resources available for people to run? And I think that's also, part of the work ahead, is that if we really want political representation by us and for us, how do we support people not only at the local level, but also, just running for anything? So I think that's also a challenge and a call to action for disability communities everywhere.
Thank you. Yeah, I fantastic outline of, I think, the work ahead for our community. And so we just have a few more minutes, and I'm going to ask just one last question of you all, which is a take-home point, if you're willing to share, for those in the audience, of what they can do today, the people in attendance, to support your work, disability advocacy, today, tonight, tomorrow, from your viewpoint.
Well, I think the first thing, if you have a disability and you're already involved in advocacy, keep doing it. If you are disabled and you're not, or if you know somebody who's disabled, ask them about it. Show some interest. It's not, not all disabled people are involved in disability advocacy. I think probably most are not on a day-to-day basis. And there's a lot of reasons for that, but bringing it up as a thing to talk about, as a thing to be curious about, I think helps make it less stigmatized. Oddly enough, disability advocacy and activism can be very stigmatizing. People think it's boring. They don't like politics. They're afraid you're going to be haranguing them all the time. They roll their eyes. It's not universally admired, oddly, to be an activist. So I think to serve that the overall cause, I think destigmatizing it as much as you can is something that anybody can do, to say that when somebody brings it up, to have a positive response, to be curious, to be open to it. That's one thing anyway.
Yeah, I'm just gonna quickly drop in this topic about vaccine equity. So I think whichever state you're located in, take a look at your state's vaccination plan. who are the people, the groups that are prioritized. And if you don't see the people with disabilities, chronic illnesses, the people who are immunocompromised, if they're not part of the tiered prioritization, ask your governor why, ask your local representatives why, and just ask these questions. And I think that to me is one of the biggest issues right now, is that anybody can do that. And I think that's the real kind of concern I have right now, is that so many people are left out and have to expend so much energy just for the basic equity. So I think when we think about equity, when we think about disability, when we think about equity and we think about diversity, you've got to also think about disability.
Yeah.
That's my takeaway.
I'm gonna go a little more basic. I think if you're a disabled person, tell your story. There's nothing more powerful than our stories. We've seen political change based on a chance encounter where someone shared their story. I'm thinking here in New York, for example, a politician was doing, knocking on doors to say vote for me, and came to a door and heard the story about someone who couldn't hire a family member as a personal assistant. And that politician then introduced a change to the law that allowed family members to serve as PAs. Your stories have power, and share them as widely as you can. If you're a non-disabled person who wants to be an ally, make sure you listen to our community. Go out of your way, whether it's a family member, find out what's going on in their lives, what's important to them. If not, come onto Twitter, come to Facebook, go to the hashtag, go to some of the other hashtags, whether it's RevUp or I don't know, disabled and cute. There's so many hashtags out there with our community. You listen to what disabled people have to say. I can't think of anything more important.
That's good.
With that, no better way to end this discussion. Alice, Andrew, and Greg, thank you so much. Really grateful for your time.
Thank you for having
Thank you
us.
for having us and doing this topic.
Let me also offer my thanks to the panelists. Thank you so much, Alice, Andrew, and Greg, for joining us tonight. Great discussion. And thank you, Bonnie, for wonderful moderating. As Greg said, all issues are disability issues, and it's important to remember that perspective when working for a stronger democracy. So I'm thankful to all of you tonight for thinking about these questions. Thanks to the Johns Hopkins Disability Health Research Center for making this possible, and thanks for everybody for asking good questions. I wanted also, just before you go, invite all of you to join us for our next Democratic Spaces discussion on March 17th from 7 to 8 about dissent and disagreement. We'll be joined by Suzanne Nossel, PEN America CEO and author of Dare to Speak, Defending Free Speech for All, Dahlia Lithwick, senior editor at Slate and host of the Amicus podcast, and SNF Agora's own Martha Jones, Johns Hopkins historian and recent author of Vanguard, How Black Women Broke Barriers, Won the Vote, and Insisted on Equality for All. They will discuss the importance of fostering spaces for speech, including spirited dissent and disagreement, as a means to advance democracy, defend against authoritarianism, and ensure that all voices can be heard. For more information about our upcoming programs, you can visit our website at snfagora.ghu.edu. And you can also sign up for our bi-monthly e-newsletter by clicking the link in the chat or emailing us. Thanks again, and I hope you enjoyed the rest of your evening.